And our next speaker, continuing with the public health theme, is Erika Moreno. Erika is a graduate of the University of California at San Diego. She was an environmental engineering major, and she worked abroad teaching for a year and then came back and in a similar role working with children in education in Los Angeles area, and really came to find an interest in climate change through the pathway of all of the social justice and environmental justice elements that are present in all of these issues. And really the climate refugee crisis is something that interests her a lot, and she really overcame a lot this year because part of her planned capstone involved some pretty significant travel, and obviously that was impossible. So she adapted and put together a capstone that dealt with the same topic just without the travel. So definitely really appreciative of Eric's flexibility on that. And it's my pleasure to introduce Erika Moreno. You have the floor.
Thank you, Corey. Good afternoon, everyone. My name is Erika Moreno, and my capstone project was about the environmental justice implications for the Paris Low Emission Zone. My motivation for this project stemmed from my desire to take on a project that would in some way evaluate how to reduce ambient air pollution in a way that is equitable for society. With the help of the chair of my capstone advisory committee, Dr. Tariq Ben Marnia, I was able to connect with Sabine Host from the Regional Health Observatory in Paris, France, who has been studying the Paris Low Emission Zone and its impacts on ambient air pollution and human health. Together with my advisors, I have taken their research further to try to understand how equitable this policy truly is. For this study, when we talk about ambient air pollution, we are specifically looking at traffic-related air pollutants, those that are emitted from a gasoline or diesel engine. These compounds that are emitted from a tailpipe are known as criteria air pollutants. Such pollutants include particulate matter, nitrogen dioxide, sulfur dioxide, and carbon monoxide. Compounds like nitrogen dioxide and carbon monoxide then go on and form other dangerous compounds in the atmosphere like tropospheric ozone. High exposure to these compounds are harmful to both the environment and human health. Some health risks associated with criteria air pollutants are cardiovascular disease, respiratory disease, neurological impacts, and adverse birth outcomes. However, the risk of developing such diseases depends on the conditions of the places where people live, work, and recreate. These conditions are known as social determinants of health. This means that individuals and communities that are in close proximity to traffic on a daily basis may experience a differential exposure to air pollution than perhaps those that live further away. Or perhaps their economic status and access to healthcare make them more susceptible to developing more serious complications or other comorbidities. This is where equity and environmental justice come into play, because communities that are subject to differential exposure and differential susceptibility are often poor communities and communities of color. We can define the role of equity further by saying inequities in health are health disparities that systematically put groups of people who are already socially disadvantaged at further disadvantage with respect to their health. So what have governments done to address this issue? The most common policies that attempt to improve air quality are national regulation schemes, like the US Clean Air Act or the Ambient Air Quality Directive implemented by the European Union. Other approaches include congestion charging schemes where all vehicles are required to pay a toll to operate in high traffic zones. However, the most popular approach to improving air quality in major European cities are low emission zones. These zones restrict the entry of high polluting vehicles either on a 24/7 basis or only during peak hours. Additionally, vehicles are restricted based on their Euro standard classification, which means that the year they were made and their engine type, vehicles are primarily grouped based on the year they were made and their engine type. To date, over 250 LEZs exist across Europe, and some cities in Asia have also adopted this model, including Beijing, Shanghai, Tokyo, and Singapore. Hi, everyone. Sorry for the technical difficulties. Let me just reshare. And I will pick up from this slide. Let me just make sure everything looks good. Okay. So for this study, when we talk about, let's see, I'll start from slide 3. So what have governments done to address this issue? The most common policies that attempt to improve air quality are national regulation schemes like the US Clean Air Act or the Ambient Air Quality Directive implemented by the European Union. Other approaches include congestion charging schemes, where all vehicles are required to pay a toll to operate in high traffic zones. However, the most popular approach to improving air quality in major European cities are low emission zones. These zones restrict the entry of high polluting vehicles either on a 24/7 basis or only during peak hours. Additionally, vehicles are restricted based on their Euro standard classification, which means that vehicles are primarily grouped based on the year they were made and their engine type. To date, there are over 250 LEZs across Europe, and some cities in Asia have also adopted this model, including Beijing, Shanghai, Tokyo, and Singapore. To start my research on low emission zones and gain a full understanding on what we currently know about LEZs and their effectiveness in reducing air pollution and improving health and equity, I conducted a literature review. As a result of this review, I found a total of 15 studies that were submitted in English since 2012. All of these studies addressed reductions in air pollution, and the most common pollutants studied were nitrous oxides and PM and particulate matter. 6 of these studies were also interested in observing health impacts such as all-cause premature deaths in adults over 30 years old, respiratory symptoms in children like asthma and allergies, as well as preterm birth and low birth weight. Only one of these studies addressed equity and found that health gains due to an LEZ were skewed towards wealthier residents. When it comes to air pollution in France, there is a significant burden of evidence to show that this is a serious public health issue that needs to continue to be addressed. For example, one study by Degan et al. Found that low socioeconomic groups experience higher rates of long-term NO2 exposure, which makes them subject to a higher risk of all-cause mortality during short-term peaks of NO2. Additionally, it is estimated that around 6,600 deaths are attributable to chronic air pollution in Paris annually. In all of France, this figure is about 60,000. For children, it is also estimated that 16% of new cases of asthma are attributable to traffic-related air pollutants. If policies related to regulating air pollution are implemented effectively, the French healthcare system could also see a savings of up to 2 million euros annually. Narrowing down now on the Paris Low Emission Zone, in 2015, the metropolis of Greater Paris also adopted the Breathable Cities in 5 Years initiative as part of the Air Climate Energy Metropolitan Plan. Under this initiative was a plan to formally introduce a national framework for metropolitan low emission zones. LEZs were chosen because studies showed that they would have the greatest and quickest impact on improving air quality. In 2015, the Paris LEZ was drafted and introduced under a 5-phase rollout schedule that will be complete by 2030. The end goal of this policy is to eventually restrict 100% of exhaust-emitting vehicles from entering the zone. The way the Paris LEZ works is by classifying vehicles into several categories. These categories are titled Crit Air and are numbered from 1 to 5. The higher the number, the more pollutants the vehicle emits. A 6th category is labeled Crit Air Vert, which refers to electric or hydrogen vehicles that emit zero exhaust-related pollutants. There's also the unclassified category, which refers to vehicles registered before 1997 and does not receive a Crit Air designation. Factors that determine which category a vehicle falls into are the vehicle's engine type and Euro standard. The Paris LEZ also restricts these vehicles only during peak hours. Heavy-duty vehicles are restricted daily, while all others are restricted only Monday through Friday. To date, Crit Air 4, 5, and unclassified vehicles are restricted from entering this zone. The aim of this capstone project was to extend the work of Ms. Host and her colleagues, which sought to determine what would be the most optimal scenario for implementing phase 2 of the Paris LEZ. Their evaluation was primarily focused on the expected air pollution reductions and the expected health benefits. For air pollution, they studied reductions in NO2, PM10, and PM2.5. For health impacts, they studied how many cases of premature death, ischemic heart disease, childhood asthma, and low birth weight in full-term babies could be avoided with respect to the reduction of NO2 and PM2.5. Their methods involved evaluating the hypothetical implementation of one of 4 scenarios. These scenarios involved 2 different LEZ perimeters, that of the Paris Ring Road and that of the A86 Ring Road, and 2 levels of restriction. The band high scenario includes the restriction of Crit Air 3 vehicles, while the band low does not. Their approach to determining these values meant conducting a health impact assessment, which quantifies how many overall cases of death and morbidity could be prevented due to reduced levels of NO2 and PM2.5 in the environment. My contributions to this study involved evaluating two of the same pollutants, NO2 and PM2.5, and two of the same health outcomes, which were death and childhood asthma. I also evaluated the same four scenarios. However, my research adds on to the Host et al. Study by incorporating new relative risk values that are tailored more towards each socioeconomic group. In the original health impact assessment, only one relative risk value was used to evaluate all socioeconomic groups. In my health impact assessment, I used 3 different relative risk values and applied them to 3 different socioeconomic groups. These values were pulled from a study by Talentquite et al., which hypothesized the effect of air pollution reduction policies on health and equity by conducting a health impact assessment using spatial analysis methods. In this study, they were able to map out the spatial variability of NO2 exposure with respect to socioeconomic status by census blocks. So what I have done is that I have combined the methods of the Host et al. Study and the Talentquite et al. Study in order to paint a truer picture of the impacts the Paris LEZ may have of differential exposure and susceptibility in the region. For simplicity of this presentation, the results that follow in terms of health improvements will emphasize what we found in terms of reduced cases of childhood asthma, specifically attributable to reduction in NO2 exposure for each scenario and in terms of equity. Here's a brief roadmap of how I got my final results. First, I replicated the health impact assessment conducted by Host et al. To make sure I knew how to correctly conduct an HIA. Next, I categorized each census block into 3 socioeconomic groups based on its FDEP score. The FDEP score is an indicator of the level of social deprivation for each census block. After that, I then applied the 3 relative risk values from the Talentquite study to each SCS group and determined the attributable number of cases avoided for each health outcome. Lastly, I mapped these results using arc maps and evaluated the ratio between the number of cases prevented in each SCS group relative to their population size. And I did this for all 4 hypothetical LEZ scenarios. Here are the results found by Host et al. Of the expected benefits we might observe with respect to reductions in NO2 and PM2.5 emissions. On the left, we have 4 pink maps that demonstrate annual reductions in NO2 exposure based on each of the 4 scenarios. And on the right, we have 4 green maps that demonstrate the same thing, but for PM2.5. Each of these maps break down these reductions on the finest scale possible, which is by census block. The table below are the results that Host et al. Found in terms of the impacts each scenario would have on air pollution. The key finding here is that for the LEZ enlarged band high scenario, we could expect to cut NO2 and PM2.5 emissions in half. Looking at health and equity, we found that while each scenario produced a significant amount of reduced cases of asthma, the LEZ enlarged band high scenario, which involved the largest perimeter and the most stringent vehicle standards, saw the highest total reduction of asthma cases. In terms of equity, this table demonstrates the distribution of prevented cases of childhood asthma for each SCS group. And what we see is that, again, the LEZ enlarged band high scenario has the most equitable spread of reduced asthma cases based on population size. Here are those same results mapped out for the LEZ Paris band high scenario. On the left, we have the spatial distribution of the social deprivation index, where the darker areas are considered low SCS communities. And in the map on the right, we have the distribution of the reduced cases of asthma. What's great is that the low SCS zones match up somewhat well with the areas that see higher health benefits. As you can see in the chart as well, for this scenario, we can expect to prevent a total of approximately 1,653 cases of asthma if we only restrict vehicles in the Paris city center, but restrict all vehicles in the Crit Air 3, 4, 5, and unclassified categories. Now, if we look at the most optimistic case, the LEZ enlarged band high scenario, we are able to observe the most equitable spread of health benefits related to asthma. Keep in mind as well that the LEZ enlarged perimeter only extends to these communities approximately. Based on the data alone, we see a total improvement of 3,200 cases of asthma avoided, where there's virtually an even spread of benefits based on the population size of each SCS group. These results related to childhood asthma are particularly important because children are more susceptible to the consequences of air pollution, specifically because they have smaller lung capacities. They also have faster breathing and heart rates, so their levels of exposure have more of an impact on their developing bodies. Should they develop asthma or other respiratory diseases, these morbidities can impact the development of proper lung function into adulthood. This study is unique in that it is the first time this health outcome has been evaluated with respect to equity on a fine scale. The number of asthma cases avoided are also significant when compared to what other studies in other cities have found. The next steps for this evaluation would be to evaluate the economic impact of enforcing this policy on low SES communities. The fact that low SES households are more likely to own a high polluting vehicle and less capable of switching to a better alternative has implications on rates of compliance. It would also be important to present these findings to the relevant stakeholders in Paris so that the value of studying equity can be enhanced and so that these methods can be applied to future studies. However, there were some limitations that should be discussed. The first is that the relative risk values used were not based on the socioeconomic landscape of Paris. These values were actually pulled from an Italian study that simply stratified the general impacts of air pollution on different socioeconomic groups. Additionally, the results obtained in terms of air pollution reduction were based on theoretical models. As time progresses, it will be important to observe the real-world implications and how this reduced exposure truly impacted health and equity. Lastly, due to lack of data, other health outcomes could not be studied. We know that air pollution impacts every area of the body when subjected to high levels of exposure, so I think it would be even more interesting to see what other health outcomes could be positively impacted by the reduction of long and short-term trap exposure. As a final note, this study is relevant to current events because in the wake of the COVID-19 pandemic, preliminary studies have shown that cities known for higher levels of ambient air pollution may be more susceptible to higher cases of mortality or higher cases of severe complications. Additionally, given the current social justice battles we're facing, like the Black Lives Matter movement, we cannot overlook the fact that, especially in America, it is poor Black, brown, and immigrant communities that are forced to live in areas that come with higher environmental risks. By considering the needs of these communities from an air pollution standpoint, we can make significant strides in achieving climate justice. And finally, when it comes to policymaking, this study is important because as nations and governments attempt to rein in and regulate their ambient air emissions, the consistent oversight in considering environmental justice implications is simply not acceptable. We as a society cannot continue to create environmental policies without incorporating provisions for equity, because without acknowledging the social injustices that exist across society and how they impact the nexus of climate change and human welfare, it will not be possible for any clean air initiative to truly eliminate the burden of ambient air pollution. Thank you so much, guys, and I'll take any questions.
Great job, Erika, especially navigating some of those technical difficulties. Your presentation was fantastic. We have time for about one question, which is perfect. We have one waiting for you from Larry Sarah, and he asks, how are low emission zones enforced in Europe?
So there's two essentially main methods of enforcement. I know that in London it's digital, so there's cameras that can read the license plates and catch who's not supposed to be there. But most zones, I would say, including the one in Paris, is monitored manually, so only by law enforcement seeing who's who they catch.
Excellent. Well, great job. Thank you so much again. We really appreciated your time and effort in this project.
Thank you.